So our pandemic experience was a little bit unique again. While we would have experienced COVID with the rest of the region, for us, we had to deal with an outbreak of dengue. We had to deal with a global pandemic, and we had to deal with a volcanic eruption, all happening within close proximity of each other. That was a lot of, I wouldn't say strain, but it was a lot of expectation from our laboratory sector, because we had to be there to support the public health preparedness and response initiative. It was just a lot. I remember when we had the index case for COVID-19, when that first case was diagnosed, there was so much of a panic in terms of what the fallout was going to be with COVID-19, and there was such a frenzy in terms of the contact tracing and sending samples off to CARPHA, and the uneasiness in terms of just sitting and waiting on those results to come back. Shortly after, I think we took a national decision to build capacity on island, so we would have been able to do our testing here in St. Vincent and the Grenadines and be able to provide information to the public health team at a much faster rate. That was really challenging. It occurred at a time when internationally there were certain policies coming out of, let's just say, the US, that was not releasing resources for PCR testing and instrumentation. And it was really a challenging time for us in terms of sourcing those equipment. We were leaning on our partners. We were having conversations with PAHO, we were having conversations with ambassadors overseas. But we came through. We came through to set up our own PCR testing facility, but we would not have realized a lot of these successes we had if we didn't have the partnerships. And I think the partnerships are what are important, the collaborations we had nationally and regionally. We were able to rely on CARPHA. CARPHA did the entire validation process for us, which allowed us to ensure that our systems are working, and we were able to turn out results that our team could have relied on. In terms of nationally, PCR testing was relatively new to a clinical lab. We didn't have a public health type of laboratory. We didn't have the skill sets who were trained and were doing PCR testing. So we had to form those linkages with our Bureau of Standards. We were able to rely on our cannabis authority, who had persons on island who were trained in molecular diagnostics, and we were able to lean on those persons who helped us along the way. Now we have persons at the lab who are MLT people. When I say MLT, they're medical laboratory technologists, and they are trained in doing hematology and clinical chemistry, but we have built capacity with them in terms of partnering with PAHO. PAHO is very instrumental and very important, and partnering with CARPHA, who have allowed us to build those capacities that now we can rely on our own people to do that sort of testing for us on island. In addition to that, I think where we are now focusing on testing, we are now using CARPHA in more or less a different capacity, because we're not so much relying on CARPHA for initial diagnosis. We are more sending our positive samples to have them sequenced so we can know what sort of strains we have circulating on island. And also we're using CARPHA as our external quality partner. They're the ones who are really our watchdogs, to let us know that our systems are operating and our systems are working efficiently. So some of the lessons that we really learned during COVID times is that you can't go at it alone, that you really need that collective approach if you are going to be delivering services that is going to allow your community to be happy, healthy, and productive. That you really have to form these coalitions, and is one of the things that we want to sustain, that we have been trying to sustain, where we are trying to formalize a lot of the partnerships that we have built during the COVID times.